Now we will start with the continue with the point where we had stopped last. In the previous class, we have discussed about the dosha and the status of the doshas in the body. Now, the next is about the Kriyakara, one of the important concepts of Sushruta, which gives you an opportunity to treat the disease and then how the disease is evolved. That evolution of a disease process is a very unique concept and very useful concept even. Now, once the doshas are there in the body, and if there are any factors which will affect the balance between the doshas are in balance, and if the balance is affected, then there could be the pathogenesis, and the pathogenesis starts with the first step is the dosha vruddhi. Now, vruddhi doesn't mean there is always an increase in the quantity. It could be either increase in the quantity or increase in the quality, or it could be increase in its functions. So it could be either gunavritti or karma vritti or pramana vritti. So it could be any of these, and many times it could be all of them, or it could be one or two of them which can occur. Now, etani khal doshasthanani yeshu sanjiyante doshaha. So once the doshas are affected due to extraneous factors, there could be the sanjaya or the vruddhi, and prak sanjay hetu ukta. The prak sanjay hetu are mentioned already because the qualities which are comparable or which are equal to that particular dosha, there could be vruddhi of one dosha, or there could be vruddhi of more doshas, like a shita guna. If there is an exposure to the shita, there could be vriddhi of kapha as well as vriddhi of vata, because both of them have the shita guna. If there is a corresponding ruksha guna along with the shita, then there will be proportionately more of vata vriddhi. If there is a snigdha guna along with the shita, then there could be kapha vriddhi. So this way, there would be a permutation and combinations and complex combinations of the doshas. It's not a simple single equation. So that's the point which you have to keep in mind. तथा संचितानां खलु दोषाणां स्तब्धपूर्णकोत्सता पीतावभासता मन्दोष्मता च अङ्गानां गौरवम् आलस्यं क्षयकारणविद्वेषश्चेति लिङ्गानि भवन्ति. The general clinical symptoms of a vata dosha vruddhi are stabdhapurna kostata, a feeling of discomfort and feeling of fullness in the abdomen. Pitava bhasata, in case of pitta vruddhi, there is a tendency to feel like yellowish color. Now, yellowish color which a patient can perceive in the vision, or it could be over the body. Not necessarily that there is an icterus. So pita avabhasata, it's not a pita varna, pita avabhasata. A feeling of having a yellowish feature. Manda ushmata anganam gauravam alasya. In kaphaja vruddhi, there would be body temperature could be reduced, or total activity, the energy generating activity of the body would be lesser. You'll feel lethargic, and alasya, of course, the lethargy only, gauram, heaviness, and in general, there is a property in the body. Nature has given you a capacity to avoid the possibility of a disease process. So once there is a pathogenesis, that initial pathogenesis, generally there would be a dislike for the cause which has generated. Like suppose you have taken some food which is in excess, and which can produce a discomfort or produce a vata vriddhi later on, then the next after a few hours you will feel like having that discomfort in the abdomen, but at the same time you will also have some dislike for the food. You won't feel like taking the food again till the balance is clear, or till that abnormality is clear. Now, and that's a nature's gift to the animals. Every animal would have that kind of a reflex where there is a possibility of spontaneous correction of the possible defects. It's only the human being who neglects that natural instinct and then subjects himself to the disease. Even if you do not feel that hunger, if you eat again, then there can be the further progression of the disease. If you do not do that, suppose there is a mild imbalance, and then like having more food, and next time in the next food hours you avoid that consumption of the food, then there is a possibility that the possible defect is corrected by itself. So being sensitive to the changes in the body, and having some special these simple corrective methods. That's what Vagbhata has said in case of the Dinacharya. Sharira Chintam Nirvartya. Sharira Chinta is you just assess, consider your, or just assess the status of the body, and then with the very simple methods you can identify what are the possible defects which could be there and which could be avoided. So if you follow that, then you may not require any further treatment or further disease. There could be a spontaneous natural cure which is present in the body. Only when you neglect those symptoms, then only there is a possibility of the disease. So, and this is a very important key and a very significant contribution of Ayurveda, where you can identify these simple changes, minor changes, which are not evidence based, where you cannot find a disease evidence. Now, this is one of the important statement. See, even before you find an evidence, you can identify the illness, and that illness can be corrected spontaneously without any intervention from exterior. And this capacity can be built up. And of course, from the practical clinical point of view, when a patient comes to you, he has already crossed up these stages, and it may not be useful for the patient to be for the patient when you advise these things. But it could be useful for at least yourself. So, a Ayurvedic doctor can maintain a better health if he is sensitive to Ayurveda Upadesheshu Paramadaraha. That's what Bhagavata has said. So, what do you mean by that? Upadesheshu Videha Paramadaraha is following these basic beneficial facts, and by that you can maintain health. Tatra Prathama Kriyakara. That's the first of the opportunity to treat that. And the same in Bhagavata has said, Vruddhi Sudhamnyeva Pradveshu Vruddhi Hetishu Viparita Gunechata. Now, Bhagavad has added, there is a viparita guna ichha. You will have a desire to have the other property. Like when you have eaten more of oily and maybe a sweet food, next time you may feel like having some less oily and dry food as such. That's the one. Now, the causes for this Sanchaya again, whatever Vagbhata has mentioned, of course, the same is already discussed. We have discussed earlier with Sushruta. Vagbhata has given in a form which can be easily memorized in the form of shloka. That's all. There is not much of a significant addition, but the organization of the sentences, organization of the speeches are very classical in Vagbhata. And from that point of view, I have just quoted the shloka, which is just whatever has been mentioned earlier in the previous session by Sushruta, its repetition as such. Now, अतऊर्ध्वं प्रकोपणानि वक्ष्यामः. So after the, if at all the vruddhi is not tackled properly by the natural instincts, it will go into the next stage, that's the prakopana. Some of the common causes for the prakopana are a balavat vigraha, a fighting with somebody who is stronger than you, or it's ayatha balam arambha, going beyond your capacities, doing some any fighting or any other exercise, going beyond your capacity, which could be either a balavat vigraha, fighting with others, or ativyayama, excess of exercise of any sort, like going for trekking without that conditioning of the body. Then avyayama, it also could be the other way, like if you do not do the exercise. Adhyayana, too much of reading. Prapatana, falling. Pradhavana, running. Prapidana, compression. Abhigata, trauma. Langhana, too much of the fasting. Or plavana, tarana, plavana is the swimming. Tarana is again floating over the water. Ratri jagarana, is avoiding the sleep at night time. Bharaharana, that's carrying a heavy weight. Gajaduraga Ratha Pradati Charya, traveling on vehicles. In those days, the major vehicles were elephants, horse, etc. But now you have two-wheelers, four-wheelers, and so on. So, and Katukashaya Tikta Ruksha, Laghu Shita Virya Shushka Shaka Valluraka, Uddalaka, Kora, Dusha, Shama, Kanima, Ramudga, Masura, Adaki, Harenuka, Harenu, Kalaya, Nishpava, ಅನಶನ ವಿಷಮಾಶನ ಅಧ್ಯಶನ ವಾತಮೂತ್ರ ಪುರೀಶ ಶುಕ್ರ ಛರ್ದಿ ಕ್ಷವತು ಉದ್ಗಾರ ಬಾಷ್ಪ ವೇಗ ವಿಘಾತಾದಿಭಿ ವಿಶೇಷೈ ವಾಯು ಪ್ರಕೋಪಂ ಆಪದ್ಯತೆ. The other food habits where you do not mind about the quality of the food, but I can summarize all these as junk food. Ruksha, Lakhu, Shita, Vira, Shushka, etc. They are the junk food varieties which were available in that period. Now you have a different sort of the junk food, and it could be like then Vishamashana, Adhyashana, etc., where you know about this improper consumption of the food or too much of consumption of the food, and even Vega Vidhara, suppression of the natural urges. These can result in the Vata Prakopa. So the possibility of a change where the disease can occur, disease can progress, again is in your hand. You can prevent this formation of the disease at this level. तत्र शीताभ्रप्रवातेषु घर्मान्ते च विशेषतः प्रत्युषसि अपराह्णे तज्जीर्णे अन्ये च प्रकुप्यति. There is a natural tendency for the dosha prakopa due to the external seasonal factors like Shita Abhra Pravateshu. So when there is a sudden cold changes in the weather, like today, all of a sudden it starts, the temperature has fallen, or Dharmante at the end of the summer, or Pratyushasi early morning, or Aparane in the evening, Jirne at the time of the digestion, there is a the total protective reflexes of the body are relatively weaker, and you are more prone for the disease at that period. क्रोध शोक भय आयास उपवास विदग्ध मैथुन उपगमन कट्वम ललवण तीक्ष्ण उष्ण लघु विदाहि तिल तैल पिण्याक कुलत्त सर्षप अतसी हरितक शाक गोधा मत्स्य आजाविक मांस दधि तक्र कूर्तिक मस्तु सर्वीरक सुराविकाराः अम्लफल कट्वर प्रभृतिभिः पित्तं प्रकोपम् आपद्यते. For the pitta prakopa, the karanas reasons are strong emotions like anger and so on, or too much of indulgence, sexual indulgence, as well as the consumption of the food which are more spicy and having Ushnavirya. And these food substances which are mentioned in Sushruta may not be the food substances which are consumed now. So you will have to identify the food substances which have these properties which are available in the present day situation. And this can result in Pitta Prakopa. तदुष्णे हि उष्णकाले च घनान्ते च विशेषतः मध्याह्ने च अर्धरात्रे च जीर्णत्यन्ये जीर्यत्यन्ये कुप्यति. The Pitta Prakopa tends to occur in very warm season and warm mid of the day, and maybe at the end of the rainy season, and Madhyane in the mid of the day or Madhyaratri in the midnight. There is a possibility of higher tendency for the Pitta Prakopa. Now, the Kapha Prakopa Karanas, Diva Swapna, Vyayama, Alasya, Madhura, Amla, Lavana, Shisa, Snigdha, Guru Pichila, Abhishandi, Hayanaka, Yabanaka, Naishada, Itkata, Masha, Mahamasha, Godhuma, Tilapista, Vikriti, Dadi, Dugda, Krishara, Payasa, Ikshu Vikaran, Anupa, Udakamamsam, Vasa, Bisa, Mranala, Kaseruka, Shungataka, Madhura, Valifala, Samashana, Adhyashana, Prabhuti, Vishleshma, Prakopama, Padyate. Kapha Prakopa Karanas are sleeping during the daytime, not doing any exercise, and the consumption of too much of sweet food substances. And then there are specific food substances which were more commonly used in those days. Of course, some of them are used now, like Masha, black gram, and Godhuma, wheat, and so on. But some of them are not used now. So you will have to identify those food substances which are used now as they are presented, whether they are kapha prakopaka or vata prakopaka, they can be easily classified. So शीतैः शीतकाले च वसन्ते च विशेषतः पूर्वाह्णे प्रदोषे च भुक्तमात्रे प्रकुप्यति. Immediately after the food or in cold season and vasanta ritu, the possibility of kapha prakopa is more. पित्त प्रकोपनेरेव च अभीक्षणं द्रव स्निग्ध गुरुभिः आहारैः दिवा स्वप्न क्रोध अनल आतप आश्रम श्रम अभिघात अजीर्ण विरुद्ध अध्यक्षणादिभिः विशेषैः असृत् प्रकोपम् आपद्यते. Sushruta, because he has considered Rakta also as a dosha, he has specified the Rakta Prakopaka Karanas, which are consumption of too liquid substances, and those substances which have snigdha and guru ahara and divaswapna, sleeping in the daytime, also can result in Rakta Prakopa, and emotional disturbances which are similar to that of the Pitta qualities, they can produce the Rakta Prakopa. यस्मात् रक्तं विना दोषैः न कदाचित् प्रकुप्यति तस्मात् तत्स यथा दोषं कालं विद्यात् प्रकोपणे. Now, Rakta dosha cannot get initiated without the involvement of the other doshas. There will be some other doshas also, and hence the symptoms of Rakta Drushti can vary according to the other dosha which triggers the Rakta Prakopa. Now, the common clinical symptoms which could be produced due to these, the dosha prakopa are tesham prakopat koshtatoda sancharana, the pain in the abdomen which tends to become movable. That's a hyperdynamic status. Now, in the vata vritti, it's just there will be a distension of the abdomen, whereas here it's a sancharana. You will have that hyperdynamic situation or quality pain in the abdomen is sign of vata prakopa. A dull type of pain with the distension is a sign of vata vritti. This can be made out easily if you keenly observe the changes which occur in the body. Amlika, Pipasa, Paridaha, these are the clinical symptoms of Pitta Prakopa. Sore irritations, excess of thirst or burning sensation. Annadvesha Hridaya Utpedashta Jayante due to Kapha. For the Kapha Prakopa, you will have a dislike for the food and a discomfort in the chest, which is commonly seen in those persons who consume more food. Now, these are common symptoms which are felt almost every day, but only the difference issue is these are not noted and these are not given due importance by many of the people, and this itself will be resulting in the diseases. So if you take care of these early symptoms, the progression of the disease can be easily prevented. Tatra dvitiya kriyakalaha. Now in Bhagavata again, just I refer to Bhagavata simply because those the same issues, it's whatever Sushruta has mentioned, the issues are presented in a memorable, easy to memorize pattern. The shlokas are usually most of the Arabic students who have studied these shlokas then really have gone to Sushruta's Samhita. So from that point of view, I have just referred to this, but it's the same. There is nothing specific or nothing new additional as such. Now, Atavurdham Prasaram Mukshamaha. The Prasaravastha is the next stage where a Prakupita dosha leads to a going beyond its area or content or the ashaya. Dosha ashaya will be crossed. Tesham yebihi atanga visheshehi prakupitanam kinva vivaka pishta samavaya eva udriktanam prasaro bhavati. Sushruta has given a simile to that of the fermentation. When there is a fermentation, there would be an increase in the quantity and there is a tendency for the overflow from the container, and a similar situation, there is a sort of chemical reaction which tends to become irreversible. The point, that's a very important point. Chaya and Prakopa, these can be reversed without any specific medical intervention by or simply by taking care of the habits or food habits as well as the simple these methods of lifestyle modification of lifestyle. That would be enough to cure the vata, any of dosha, vriddhi and prakopa. But prasara is a stage where there would be a chemical reaction, binding, and because of that binding at that stage, there has to be a specific intervention which is for the individual doshas. And this dosha, you'll have to, maybe you may need a treatment like the shodhana also, where the doshas have to be removed. So it's an example of a irreversible tendency for the irreversible changes. So that's the how it has to be interpreted. तेषां वायुः गतिमत्वात् प्रसरणहेतुः सत्यपि अचैतन्ये स हि रजोभूयिष्ठः रजश्च प्रवर्तकं सर्वभावानां. There is one view that prasara can occur only when there is a involvement of the vata. If the vata is not involved, prasara cannot occur. There is only one opinion, not necessary that it has to be universally accepted. But the changes of prasara can occur in any of the doshas, but it can move to the other area depending upon the vayu. If there is already a vata prakopa or vata condition is already affected in such a person, the prasara occurs more faster. If the vata is controlled properly, the prasara avastha can be reduced, the course of the prasara avastha can be modified. Yatha, now another example given by Sushruta. Sushruta gives two of the examples. One is the kinva udaka pishta samavaya, where there is a irreversible change and a chemical change occurring. Another is mahan udaka sanchaya ativruddha setum avadarya aparena udakena vyamishraha sarvata pradhavati. It's something like a collection of water, like a huge pond or huge dam, which tends to get broken due to some specific causes and spreads rapidly. Now, these two examples give the course of the disease. A course of the disease where rapid course occurs. See, all of a sudden, within a short duration, it presents as a disease, such a rapid course of diseases. The second example, where a dam is broken and then the vitiated doshas spread. Whereas a gradual progressive disease cannot pista samaya. The example where there is a gradual process of chemical reaction and hence the disease occurs. So the course of the disease is decided by the pattern of the dosha vitiation during the onset of the disease. एवं दोषः कदाचित् एकशो द्विशः समस्सः शोणितसहितः वा अनेकतः प्रसरन्ति. During the prasara, the doshas can be having a single doshas involved, prominence of one doshas or prominence of combination of doshas in either combination of two or combination of three, and hence you can have a counting of the possible variations, and these are considered as a Panchadashada, 15 according to Sushruta. There is a bit of difference in the opinion of different authors about these numbers. Now, anyway, for Sushruta, he has given the possible permutations of the doshas involved, like Vata, Pittam, Shleshma, Shonitam, Vata Pitte, Vata Shleshmano, Pitta Shleshmano, Vata Shonite, Pitta Shonite, Shleshma Shonite, Vata Pitta Shonitani, Vata Shleshma Shonitani, Pitta Shleshma Shonitani, Vata Pitta Kapaha, Vata Pitta Kapa Shonitani, iti Panchadashada Prasaranti, because Sushruta considers Rakta as a dosha. When it comes to these stages or possible number of the dosha variations, permutations of doshas, then the number is 15 according to Sushruta. कृष्णे अर्धे अवयवेवापि यत्राङ्गे कुपितो वृषं दोषो विकारं नभसि मेघोत्तरवर्षति नाट्यर्थं कुपितश्चापि लीनो मार्गेषु तिष्ठति निष्प्रत्यनीकः कालेन हेतुमासाद्य कुप्यति. Now this dosha which starts moving from its location, when it moves around the body, it depends upon the possible location. If there is a predisposition for the disease anywhere, then the disease would occur at that spot. Now, later on, I'll give many examples. I'll try to deal with the many examples, maybe of a disease onset and compare these issues. So, for the present, we will just limit to the Kavai Gunya, the concept of the Kavai Gunya, where there is a predisposition for the disease. So, there could be multiple factors involved. The dosha visheshan could occur due to a simple single factor, but what sort of the disease would occur later would be depending upon the possible that predisposition. Or suppose I have to give an example. Those who eat ice cream to excess, ice cream can result in visheshan of either the dosha, kapha or the vata. Now, after the consumption of the ice cream, when it comes to the prasara avastha, when it presents with the disease, some may have a jara, fever, which is generalized. Some may have tonsillitis, the pain in the throat. Now, what makes that difference? Who will develop that tonsillitis? Who will develop the fever? This can be predicted if you know the exact dosha combination of that particular person, which involves all that prakriti and his their functions are the predisposition for the disease. This is what the theme of Ayurvedic pathogenesis, and this is a unique concept of that pathogenesis, which contemporary medicine doesn't consider these issues, this kind of a predisposition. Like, see, in the modern concepts, you cannot explain like one specific cause. As I gave an example of ice cream, why a ice cream will produce a fever in one person, or maybe deep respiratory infections like cough and so on, bronchitis in one person, and why it produces tonsillitis in another person. This cannot be predicted. Only after having this, we say that there is the organisms are located in that specific organ, but it cannot be identified in the beginning. So that's the point. That's a very unique concept of Ayurveda. Though practically it's very difficult to locate and identify, but this concept is very useful, at least for yourselves, to prevent the diseases. And from the practical clinical point of view, because the patients who come to you, if you come to the physician, would always come at a later stages, these three kriya kalas, chaya, prakopa, prasara kriya kalas, are of very little use. Now, clinical symptoms, by these variations of clinical symptoms occur, there is a very specific example given by Sushruta, reasoning given by Sushruta. तत्र वायोः पित्तस्थानगतस्य पित्तवत् प्रतिकारः, पित्तस्य च कफस्थानगतस्य कफवत् प्रतिकारः, कफस्य च वातस्थानगतस्य वातवत् एष क्रियाविभागः. Now, if the clinical symptoms can vary depending upon the doshas which are located and the location as such. If pitta vayu gets vitiated and then reaches to a pitta sthana, then the clinical symptoms also would be like a pitta. Treatment also would be pittavat pratikara. Like the treatment has to be pittavat. To give an example, like if you have consumed a lot of dry food and This results in involvement of the stomach. You have the gastritis symptoms, burning sensation. Pittasthana vayu results in the involvement of the pittasthana. Then the initial treatment has to be pitta. You will have to give some substances which can reduce the pitta, maybe Sutta Shekara or Kamadudha. And then after that, then the treatment has to be Vata. So only after treatment of pitta, if there is a need for the symptoms, it could be the Vata chikinsa. Similarly, pittastya kapasthana gatasya kapavata. When the pitta involves the kaphasthana, the symptoms could be of the kaphaja lakshanas could occur, and that the initial treatment has to be kaphavata. Then once the kapha, this is sthaniya dosha is treated, then the next part has to be treated. So this is one of the basic concepts of planning the management of any of the diseases. एवं प्रकुपितानां प्रसरतां वायोः विमार्गगमन आटोपौ वोषचोषपरिदाह धूमयानानि पित्तस्य अरोचक अविपाकाङ्गश्रादश्चेति श्लेष्मणः लिङ्गानि भवन्ति. The common clinical symptoms which could occur in these conditions are in case of vata, vimargagaman atopo. Now, a patient presenting with abdominal symptoms, it could be initial. Now, this is a very common experience. You might have, any of you might have experienced this. Whenever you have eaten something more or something in excess, initially you may have a discomfort in the abdomen. Later, it could be a griping pain or colicky pain. Then you may have either vomiting or diarrhea. That vomiting or diarrhea is vimargagaman. So it's now this is the sign of prasara. When you have vomiting or diarrhea, there's a sign of prasara where you need a specific treatment, medical treatment. For the initial two stages, you can prevent that by either fasting or maybe taking some light food, and then the next stage may be avoided. So that's what is ayoho vimargagamana atopo, where there could be retrograde peristalsis which can occur, which is a sign of evolving obstruction or severe irritation of the gastrointestinal tract. Now that's one example. Or similarly, in case of kapha pitta, voshachosha paridaha dhumayanani, the toxic symptoms of increased temperature and the burning sensation would be increased. Arochaka vipakangashchadi shleshmanaha, the kapha will produce anorexia, severe anorexia, and the heaviness or reduced movement of the body, and even vomiting can occur. Tatra tritiya kriya kala. That's the tritiya kriya kala. Atavurdhvam sthana samshaya mokshamaha. Sthana samshaya is the next stage which can occur. The dosha which has started moving from its location and reaches the area, and there it involves and produces the pathogenesis of that particular organ, and then only you will have the presentation of a disease which you can name, or evidence for the disease would be starting. So if you are practicing evidence-based medicine, you will be able to diagnose the disease only at that stage. But the earlier three stages, which can be quite useful in preventing the disease, they cannot be identified if you follow evidence-based medicine. Now, evidence-based medicine is given a lot of highlight in the contemporary situation. Now, from Ayurvedic point of view, this is our highlight. We have a potential literature which can, or potential information which can help in prevention of the disease, and that's the speciality of Ayurveda. Whereas in the contemporary system, you do not have a concept to consider those conditions as the disease itself, and you start with the only the once the disease has started, the evidence-based medicine. Of course, now these days the preventive medicine is one of the concepts, but even that preventive medicine doesn't recognize these stages which are really practically useful. Of course, from the clinical point of view, when a patient comes to you, when you are dealing with only a patient, then the patient will come to you only this stage or after this stage. So the earlier stages may not be useful, and that's why I say contemporary medicine is useful for the patients, and Ayurveda is for the who do not want to be patients. Now, एवं प्रकुपितान् स्थान् शरीरप्रदेशान् आगम्य तान् स्थान् व्याधीन् जनयन्ति ते यदा उदरसन्निवेशं कुर्वन्ति तदा गुल्म विद्रति उदर अग्निसङ्ग आनाः विसूचिका अतिसार प्रभृतीन् जनयन्ति बस्तिगताः प्रमेह अश्मरि मूत्राघात मूत्रदोष प्रभृतीन् मेढ्रगताः निरुद्ध प्रकर्ष उपदंश शूकदोष प्रभृतीन् गुदगताः भगन्धर हर्ष प्रभृतीन् वृषणगताः वृद्धिः ऊर्ध्वजतुगतास्तु ऊर्ध्वजान् त्वं मांस शोणितस्ताः क्षुद्रलोकान् कुष्ठानि विसर्पांश्च मेदोगताः ग्रन्थ्यपचि अर्बुदगलगण्ड अलजि प्रभृतीन् अस्थिगताः विद्रधि अनुशयि प्रभृतीन् पादगताः श्रीपद वात शोणित वातकण्टक प्रभृतीन् सर्वाङ्गगताः ज्वर सर्वाङ्गरोग प्रभृतीन् तेषाम् एवम् अभिसन्निविष्टानां पूर्वरूपप्रादुर्भावहतं प्रतिरोगं वक्ष्यामः तत्र पूर्वरूपगतेषु चतुर्थक्रियाकालः. Now, the clinical symptoms would occur depending upon the dhatu involved or the organ involved as such, and the pattern of the spread. It could be localized or it could be generalized. So, the pathogenesis could be depending upon the dhatu involved, and then the clinical symptoms which could occur due to the involvement of the dhatu. Now, you have a concept of dhatu gata vyadhis, and that dhatu gata vyadhi is again suggestive of the early stage of the evidence of disease, and that's the where you can diagnose the disease earlier. तत्र पूर्वरूपगतेषु चतुर्थक्रियाकालः. So that's the kriyakala asset where you can identify the evidence of the disease by any investigations. You may have any investigations and any of the biochemical investigations or any other investigations which can show the evidence of the disease. तद् अथ ऊर्ध्वं व्याधेः दर्शनं वक्ष्यामः. From then onwards, you will have a situation where the disease can be named and a specific pathogenic changes in the tissue can be identified. It could be any in the localized area, like शोफ अर्बुद गंति विद्युत विसर्प प्रभृतिं प्रव्यक्त लक्षणाः ज्वर अतिसार प्रभृतीनां च. The involvement of the specific tissues can be identified, so you will have a very stronger evidence. Like suppose if I have to give a specific example from the current point of view, a patient who has a tumor marker positive but the tumor area is not visible, that's the sign of the sthana samshaya. When the tissue is studied under histopathology and histopathological changes are confirming about the tumor, then that is the Panchama Kriya Kalaha, the Vekta Avastha, where the disease is presented. So, Sthana Samshaya and Vekta, the only difference is in the Sthana Samshaya, you will have the mild early symptoms, which we call as the prodromal symptoms. Vekta Avastha, you will have the prominent clinical symptoms where the disease can be named. That idea of naming a specific disease using that code of diagnosis is applicable at that stage where the patient has reached the Vekta. Now, ato urdhvam eteషाम् avadīrnānaṁ vranabhāvam āpannānaṁ shastakriyakārah. Next, if you do not treat that condition, then if it is allowed to progress, then it results in the sixth kriyakala, which is the stage of complications. Complications could be any of that. It could be complication could be one is a chronicity. The disease can become chronic, or it can having a involvement of the other in tissues, or it can result in incurable stages. So complications which can occur in the Bheda Avastha could be as Jaratisara Prabhutinam Dirgha Karan Bandha, the disease can become chronic, or it can become asadhya, it can become incurable, or it can result in Bheda, Vranabhava. We will come to that part. That Vranabhava Mapannanam, the Avadirnata and Vranabhava, these are the two important manifestations of the disease process. Vranabhava is producing an irreversible change. The Vrana is defined as Adeha Dharanata. One of the possible definition of the Vrana is Adeha Dharanata. So a disease which will keep it, maintain its evidence, stigma throughout the life, where there will be a total, even if the disease is treated, the evidence of the disease persists in the body, then that's the Vranabhava. Fibrosis, which results in fibrosis or calcification, that's the Vranabhava. Or it could be Avadirnata, metastasis. The disease can involve in more and more organs, or it can result in a necrosis of the tissues destruction, like a gangrene. These are all the examples of the Bhedavastha. Now, Sanchayancha Prakopancha Prasaram Sthana Sanshayam Vyaktim Bhedanta Yoveti Doshanam Sabhaved Bhishaka. A successful practitioner should be able to identify these stages and make use of them. As I have told earlier repeatedly, in the practical clinical field, when you are in a hospital and treating the patients, Sanjaya Prakopa Prasara Avastha are virtually of very minimal use, because the patients will come to you only in the later stages like the Sansamshaya, Vekta or the Bheda. Or majority of the patients would come to you only in the Bheda Avastha, not in the early stages. Now, to explain these concepts again, I usually use very simple examples, common examples for the preliminary students, not for PGs. But I think this example can be useful whenever you go for the teaching. To I give an idea of what's vriddhi, I give an example of a coffee cup. When the coffee is very hot, it's a gunavriddhi, very hot as such. When the coffee is very strong, then it's a karma vriddhi. When coffee is overflown the cup, given in excess, and then it's the pramana vriddhi. Now, a coffee given in a broken cup or a contaminated cup or a coffee which has become foul smelling due to any of that preparation techniques is a prakopa as such. A coffee which has spilled over and spilled over a table which can be easily masked, or a spilled over a carpet where it can be easily washed, cannot be washed off. These are the possible, the prasara avastha. When the prasara occurs and it is spilled over to a organ or a dhatu where it can be easily removed, or it also remaining conditioning of the stages of the body. If you have a healthy status, if you are a shuddha deha, then the process can be easily reversed. Just mop it up. But if your deha is not maintained properly, you are not following the Rutucharya and Dhinacharya, and you have a more predisposition disease like a carpet, that spillage of the coffee can result in a manifestation of the disease much earlier and can result in later complications. San Samshaya is a permanently spoiled steam acid. Wet and the Veda, you may reject that shirt acid. Now, I try to give examples of certain of the disease process with this Kriyakala. Now, the metabolic diseases, one major disease, group of the diseases we are now treating are the major group of the diseases, Kriyakala, like poor diet, obesity, lack of this exercise, smoking. These are now identified as the causes of the diseases. Now, among them, hereditary part I will try to deal with, but the possibility of the diseases which can occur due to the lifestyle factors is exactly the earliest, the chaya was the dosha chaya, which can be easily prevented, avoided, and it can result in any of the disease, like a poor diet. It can result in multiple diseases. It can result in cachexia. It can result in gastrointestinal tract diseases. It can result in metabolic diseases, and so on. Smoking. It can result in respiratory fibrosis. It can result in a malignancy, or it can result in atherosclerosis. So, at this stage, in the Chayavastha, you cannot predict which of the disease would occur later by simply identifying the cause. But if you prevent that cause, you can prevent the possibility of many diseases. That's the point as such. So, this is exactly what Sushila has mentioned in case of the Vruddhi. Chaya is the next stage. Now, Prakopa is the next stage where the disease results in the biochemical changes. So now I am giving an example of the myocardial pathology. In the myocardial pathology, those factors like atherosclerosis, this obesity, and poor diet can result in accumulation of the glycerides, maybe low density lipids, and high density lipids and low density lipids abnormality. There could be lipid abnormality. At that stage of the lipid abnormality, patient may not have any symptoms as such, except that heaviness or obesity and so on, but this can be even identified by your biochemical changes. It's not that every patient who has that abnormal lipid levels would end in a cardiac disease, or some may end in cardiac disease, some may end in peripheral atherosclerosis, some may not have any of the disease process. If a person takes care of his diet and exercise, the condition can be reversed. That's the Prakopavastha. Now, the same, the hyperlipidemia can result in the deposition of the cholesterol in the vessels, and the vessels may be altered. That atherosclerotic changes may occur. That's where you will have the Prasaravastha, where that vitiated dosha involves the vessels. Again, there could be two stages. In the initial stages, the atherosclerosis may be asymptomatic. It may not have any symptoms, except maybe the slight changes in the vessel circulation. But as the condition progresses, gradually there could be hypertension because the elasticity of the vessels will be reduced. Now, this is exactly the prasaravastha, where you are not able to predict what can be the disease later. A patient of hypertension may have a disease anywhere. It may be a patient of hypertension may have a cerebrovascular accident. Patient of hypertension may have a myocardial pathology. A patient may have even involvement of other vital organs like the kidney. Now, this cannot be predicted in the beginning. A patient who has an hypertension, we now consider that hypertension condition is a preventable, or you can prevent the diseases, but managing the hypertension alone would be the target. But from ayurvedic point of view, it's not only the management of the hypertension and reducing the pressure should be the target, rather that predisposing causes also have to be given more value, and hence that possible inflammatory changes within the vessels that can be reversed. And that's exactly where the it is a, the importance of ayurvedic concepts. Now, in a certain specific patient, it can result in a sthanasam vektavastha, where the disease may be presented as a myocardial infarction. Even a myocardial infarction may have different sorts of the consequences, changes, like either it could be there could be a reduced contractility which can end up in a reduced contractility, or it can end up in a tissue necrosis, or there could be electrical instability or a pericardial inflammation. So a myocardial infarction may not present with a single set of clinical symptoms. The clinical symptoms could be of different varieties. Again, which are those factors which will result in, like in a patient who has a myocardial infarction, who will have an instantaneous death with the, due to that cardiac shock, or who was the patient who result, end up in a congestive cardiac failure, which of the patient may have the pericarditis. This cannot be predicted now. Only the thing is we have better means of identifying these diseases in the present day situation. Whereas if you follow Ayurvedic concepts, there is a possibility of predicting what could be occurring, what sort of the complication occur in a patient. So that's an area which is not explored. In the contemporary science, that area is not explored, but there is a better exploration of the area of identifying the changes which have occurred. Now, if you have a capacity or potential to predict which of the complications can occur, maybe you also have an instrument or weapon by which that complication can be prevented. Now, the Vedavastha is a patient of myocardial infarction results in irreversible changes in the heart, where the muscles may rupture, or there could be a septal defect, or maybe other fatal complications which can occur, too many of them. So that's how it can be given as an example as such. So one metabolic disease, Kriyakala in metabolic disease, I have given an example. Then Kriyakala in infective diseases. Just give an example. I just give an example for each category of the possible diseases and how it can be viewed in the contemporary situation. In a infective disease, the pros, as per the contemporary situation, now as given an example of a typhoid infection, the typhoid organisms are swallowed by the ingestion route. It's not that every person who swallows the organism would develop a disease. Only a few may have the disease, few may not have any of the symptoms. You are exposed to the patients of the typhoid, but you may not develop the disease at all. That depends upon your status, your healthy condition. That the ones that consumption of this possible ingestion of a typhoid, exposure to the typhoid organism, uh, may produce a change in the body or not. Now, once it starts changing in the body and it gets lodged in the body, it starts multiplying in the body, that's the sanjaya, the dosha sanjaya avastha. When it starts multiplying in the body, then it gets a location, it gets located in some lymph node, usually the mesenteric lymph node, that's the prokop. And then when it is multiplying rapidly, then it gets into the system, and then you will have the bacteremia that's in the blood, that's a prasaravastha. Till this stage, you may not have either no symptoms or very mild symptoms. It's also considered as a the incubation period, where the patient may not have any disease process, which can be varying from 5 to 14 days in case of typhoid, and only after it has involved the bloodstream, you will have the typical typhoid fever. Till then, there will be mild fever, mild discomfort, and it may not be even able to identify like what is going on in the body. You may have a discomfort as such. But once the typical presentation occurs, then you will have the involvement of the organs like liver, spleen, and gallbladder, the stanosamshaya. Gallbladder is one of that important issue. And the Peyer's patches of the small intestines and then intestinal pathology could occur. These are the stanosamshaya and the Vektavastha of the typhoid. a complication which can occur, multiple complications can occur due to the salmonella organism, a generalized infection, or there could be abscess, or maybe involvement of specific organs. That's the Vedavastha. So, in general, in any of the infective diseases, incubation period can be considered up to the stage of the Prasara. Symptomatic stage can be the Vektavastha and the Vedavastha. This way, it can be considered. In case of a neoplastic disease, a lifetime exposures to the causes, they are the Sanjaya Avastha. And once it starts the changes, as per the current concept, the DNA modification as a cause for the neoplasm, the DNA, these general changes, genomic changes in the DNA, that's the Procopa. Epigenomic changes, where the multiplication of the tissue starts as multiplication of the cells starts as a, then normally that's the Prasaravastha. Now, if you follow that concept, of course, these lifetime exposures, they are preventable. Even the genomic instability conditions can be prevented or can be reversed at that stage. And the current concepts of the treatment of the malignancy, where you may try to have a genetic modification or genetic this manipulation as a possible treatment of the disease, is possible at these stages. But once it results in a real cancer phase where there is a breakthrough phase, the tissues are multiplied and the multiple tissues would survive, and the possibility of spontaneous destruction of these abnormal cells has been lost, apoptosis is lost, then it becomes a neoplastic malignant, and at that stage, a genetic modification or genetics correction may not be useful as a treatment. There you need to have specific anti-cancer treatment, like the suppression of that multiplication would be the treatment there. And that's the Sthana Samshaya. And then, of course, you have the Bhaktavastha and the Vedavastha, where a clinical manifestation of a specific malignant disease and metastasis can occur, where it becomes difficult to be treated. In genetic diseases, which are expressed in the later in the life. Now, genetic diseases could be of two categories. Some of the genetic diseases could be presented at the time of the birth itself. Some may be presented later. Now, those conditions where the symptoms will be presented later, the predisposition to the pathology would occur, and where it may be difficult to locate which is the Sanchayas, Vriddhi and Prakopa cannot be attributed to this genetic predisposition. But there is a possibility of a disease, the patient would have more susceptibility to the disease, and I would consider that genetic predisposition as a Khavaigunya. Now, if the patient, a patient who has a genetic predisposition, if she takes care of all that factors which can trigger the disease, and then he may survive without the disease. Only when a patient with a genetic predisposition is exposed to the triggering factors. Now, I have given one example here is of hyperchromatosis. Here the example. It could be attributed to any of the others. Suppose that is avoided, that triggering factor is avoided, the disease can be avoided. But the same may not be true in certain of the disease processes, where the genes would essentially multiply, and hence to identify Vriddhi and Prakopavastha in that condition would be quite difficult, because Vriddhi and Prakopa could be related to the intra-embryonic life. And as per our Ayurvedic text, Shukra Shonita Yoga, where it can be prevented. Of course, in the current genetics, there is a lot of attempt to correct that issue. I am not going to that part, but a prevention of that disease is one area where the simple concepts of the dosha dusha may not be applicable there, and you need to have a certain of the modified concepts. Then comes the Kriya Kala in case of postoperative and traumatic wounds. The postoperative wound or any other trauma, that wound itself would be the triggering factor, the dosha, and according to Sushruta, once the wound occurs, there is no need of specific treatment of dosha, because it's only the Kshata Ushma that is changing, so you cannot attribute it to the Vritti or Prakopa. But the whole process starts from the Sthana Samshaya itself, because the trauma has occurred, injury has occurred at that stage. then it's the sun sunfire, and then there is a possibility of vector and veda. And your concepts of the treatment would be in the initial stages, it's not a dosha specific treatment, it's about prevention of the kshataushma. Inflammation cannot, it has to be suppressed. Of course, this we will refer to in the later part when we go into the Vrana Chikitsa later on. Then once the wound has occurred, it's the already stand samshaya and vector. Then in the surgical diseases, as per the basic concepts, they you involve into the surgery, go into surgery only after the Vectavastha. So in the surgical disease, the patient either on Vectavastha or the Bhedavastha. Surgery is not indicated in the earlier stages according to Sushruta. Then there is a question of preventive surgery, whether it has to be treated now or not. So in these areas, there could be a bit of confusion about identifying these doshavastha. But basically, from Ayurvedic Sushruta's point of view, surgery has to be done only after the Vektavastha or after the Bhedavastha. Now, that's about trying to apply these doshavastha in the present day's concept of pathogenesis. Now, the last verse, Sanjay Abhata dosha labhante nokragatihi te uttara sugaticho bhavanti parvataraha. सर्वैः भावैः त्रिभिर्वापि द्वाभ्याम् एकेन वा पुनः संसर्ग कुपितक्रोधः दोषं दोषो अनुधावति. So it's always important to prevent the progression of the disease by identifying the possibility of disease at an early stage, and predisposition can be corrected. And once the disease has occurred, the possible course of the disease can be wide varying, where there could be huge combination of different sorts of the doshas, as well as the different levels of the pathogenesis can occur, and hence it's difficult to manage in the later stages. Now, whenever there is a combination of the doshas, samsarge yogariyan syal upakramya savai bhavet, shesha dosha virodhena sanipate tativaja. Whenever there is a combination of many of the diseases, then that you will have to treat that prominent doshas, which is more dominant dosha, that has to be treated in the beginning, and then the other doshas have to be treated. Now at this level, Sushruta gives you that definition of vrana, which I just quoted earlier. Vranoti yasmat rudopi vranavastu nanashati adeha dharana tasmat vrana ityachare buddhihi. Vrana is not simply a wound. Now in general, vrana is translated as a wound, but it's not only the wound. A disease process which can result in a lifetime evidence, persisting evidence, can be considered vrana, and in the area, and it suggests you of an irreversibility later on. And hence, when vrana bhava word is used in case of the Vedavastha, it's not only about the vrana disruption of the tissue, it's about the possibility of irreversible changes in the body. With this, we'll conclude. Iti Sushrutamsam Sutasthane vranaprashnabhyaya नाम एकादशो एकविंशो अध्यायः. Of course, the summary is we have discussed in detail. Functions of the body are assessed in the form of the doshas, and derangement of the could be identified at an early stage, and a possibility of prevention of the disease is a unique contribution of these concepts. Now, there are certain questions. Whatever Lakshana told to Chaya Prakopa Prasara, Chaya Prakopa Prasara, common Lakshanas for all Vyadhis. It's not at that stage, there is no question of naming the Vyadhi. In Chaya Prakopa Prasara Avastha, there is no question of naming the disease. That's what I have told. Whether a person would develop a disease or not would develop is depending upon the predisposition. And hence at that stage, you cannot name the disease. It's, the Lakshanas are specific to the doshas. As we have discussed in case of Vata, it's about the Kosa, Toda, whereas in Pitta it is Amlika, and Kapha it's the Shita Gunas asset. Then for all Vyadhis, Kavai Gunya is mandatory. Yes, once you have to name the disease, there has to be a Kavai Gunya. Kavai Gunya either could be prior to the disease, or there could be a Kavai Gunya in the later stages. In Manasika Vyadhi, where is the Kavai Gunya? That's Manas also is considered as a combination of, or maybe a factor which tends to move in the body, and we based on our concept, the manas is having that ability to connect between the buddhi and the indriya, and hence there is a passage. So that passage may not be visible, it could be invisible, and hence Kavaigunya has to be understood. Kavaigunya is not only structural, it also can be the functional. That's exactly the idea. I think with that we can conclude, And of course, there was one question in the last session, like about Vyavai Aushadhi, Vyavai Dravyas. Vyavai Dravyas is the prabhava of the Dravya which can escape the Paka process and reach to the specific areas. With that, I think there are no more questions. We'll conclude. Already we have crossed the time. Right. Okay.